Iraq is a country that continues to bear the scars of its tragic history. The loss of loved ones, destroyed infrastructure, and extreme poverty are not the only repercussions that this country endures due to prolonged years of oppression, sanctions, and conflict. Amongst the many ongoing struggles faced by the Iraqi people, untreated medical conditions are a significant problem which plagues the deprived areas of Iraq. Although there have been some efforts from the international community to address health concerns prevalent in the country, unfortunately, the pace of healthcare reconstruction remains slow. Today, many of the country's hospitals lack adequate equipment and expertise to deal with the needs of this nation, confronting ever-increasing violence and terrorism. This fragile state in which Iraq's health service currently lies has led to attempts from some voluntary organisations to try and combat Iraq's health crisis. Amongst them is the Al Hassan Foundation.
My name is Dr. Haidar Hakim. I'm an ophthalmologist here. So I've been an eye surgeon here for the last 17 years here in the UK. And I left Iraq at the age of 4, so that was in 1979, because of the religious persecution there in Iraq. And my dream was always to go back to Iraq. And the dream was always to go back and help the people there. Luckily enough, I got into medical school and I specialised in eye surgery, which is what I do. And then the opportunity came about in 2004 to go back. So I went back in 2004 after 25 years. And it was an amazing experience. You know, I just going there. In 2004, there was pretty much nothing there in terms of government and infrastructure and services. So it was an absolute eye-opening experience, seeing the lack of services, the lack of hospitals, the lack of doctors. So I had this vision that I had to do something and go back. And I decided in 2004 to dedicate my life to improving the ophthalmic service, the eye care in Iraq. As I'm sure you know, here in the UK, you know, with the NHS, there's limited services, you know, limited funding, and yet there's always constant improvement here in the services. You can imagine what it's like in Iraq because the services there need constant support and improvement.
Dr. Haidar al-Hakim began a unique initiative following his first trip to Iraq in 2004. He aimed to train doctors, help improve their surgical skills, and support them in establishing their own clinics in Najaf and Karbala. After witnessing the plight of the destitute communities in Iraq, he set up Al Hassan Foundation, a UK-based charity that sought to provide sight-saving care to this population beset by the horrors of war and conflict.
I've always been the type that want to give and want to help. Whether that's a selfish thing or not, I don't know, but it's something that I felt I was needed in that particular place more than I was needed here. So I felt that I was needed over there in Iraq more than I was needed here in the UK. The main aim of the foundation is actually to increase the awareness of the whole world to the problems that are going on in Iraq in terms of the eye diseases. Now, many of the eye diseases in developing countries can be dealt with simple things, as simple as giving glasses, as simple as screening children for eye problems. So something really simple. So as long as you put these into place at the government level, you can actually save a lot of children's sight, or you can help them prevent eye diseases in the future. And the other thing was also to improve the training of the doctors there. That was something I was really passionate about because I'm passionate about teaching and improving oneself. And there was a definite lack of knowledge and training for the doctors there. So the other important thing about the Al Hassan Foundation is that it helps the local doctors improve their training and improve their knowledge and improve their experience. And also the equipment. You know, the level of the equipment that we saw there in 2005 and 2006 was very poor. So the other aspect was also to provide the equipment needed to do these procedures.
In 2005, Dr. Hakim made his second trip to Iraq, where he left his job to himself set up a number of clinics in both Najaf and Karbala. The clinics specialise in various areas of healthcare and are open to the general public. They cater for an array of minor and major cases, but patients who require more complicated surgery are referred to the local hospital in the city.
The complicated surgery that is done in the hospitals, so we have liaised with the local hospitals as well. So if there's any complicated surgery that needs to be done, we liaise with them. It's important in these kind of areas that you have good relationships with the local doctors. The onus that we had for these clinics is make it into a community clinic. Hence it was called the Al Hassan Foundation Community Clinic. So it's a part of the community, and once it's part of the community, they treat it like part of their own, so they take care of it a lot more.
Over the years, Al Hassan Foundation has developed collaborations with ulama offices, such as that of Sayyid Ali Sistani, and also with the holy shrines of Imam Hussein and Al Abbas. The foundation works with their medical facilities and provides them with much required expertise from the UK in the fields of medicine, surgery, and management to assist them with any challenges they may face locally.
So the actual clinic itself, we've transferred it to being part of the Shrine of Al Abbasiyya. So they have the administration and we're helping with the expertise, whether it's surgical, medical or administrative. What would be nice is having more other medical specialties to be involved a lot more. There are a number of other organisations who are out there doing some great work, and you know it takes time, but it's something that we're going in the right direction. The majority of cases are pretty straightforward, so people that need glasses, people that need treatment for infections, people that have squints, which is where the eyes are not straight, so we give them exercises to do to straighten the eyes. A lot of them have cataracts, which is cloudy lenses inside the eyes, so we refer them on to have operations in the local hospitals or in special facilities organised by the Atab al-Abbasiyya and Husseiniya. There are some conditions which are much rarer. Luckily they don't come to us too often, and they can have the complicated surgery. Most of them can have the complicated surgery in Iraq. Very few of them need to go outside Iraq, and we've got connections in the local areas in Iran and also in Turkey where they can have the operations done there.
Part of the funding that is utilised in the running of this clinic is provided by the Hawza in Najaf, as well as some local ulama offices. This means that most treatment is heavily subsidised or free of charge. Majority of those who work in the clinics are dedicated volunteers who sacrifice their time and effort to provide the best medical services they can to this nation that has been deprived of adequate healthcare for so long.
So the major challenge is really funding for these kind of things, because it does need a lot of funds, and getting the funds is a big challenge. Also getting other healthcare professionals involved. There is this perception that Iraq is an unsafe place. The media doesn't help with what they portray in the media, but really most of the doctors, well, all of the doctors that go over there are actually quite surprised on how relatively normal southern Iraq is. You know, it's all kind of normal routine. So getting more healthcare professionals involved in the charity work, getting more professionals in logistics and administration and management involved, I think that's something that we as a community, maybe we need to up the ante to get them out there and propagating the need that the Iraqi people have.
Global Kindness Foundation has been going to Iraq for the last 8 years. It was founded 9 years ago by Dr. Hasnain Delji and his wife Fatima in Vancouver, Canada. The initial aim was to focus on providing free dental care, especially to the orphans in schools in Najaf and Karbala. Although it began with as little as 4 volunteers in its initial stages, the number has grown significantly over the last 8 years, with volunteers from professional and non-professional fields joining them. It has also expanded its scope from dental to now providing medical and optical care.
My name is Fatima Devji, Hasnain Devji, and I am the project coordinator of Global Kindness Foundation. We try and organize dental, optical, and medical missions worldwide. And alhamdulillah, this year we've been able to, in March, we just came back from a dental, optical, and medical mission in Iraq. We had held 2 camps in the cities of Najaf and Karbala. Alhamdulillah, in the year 2008, we were blessed to go to Iraq for our first time. We went for ziyarah and we had taken our kids with us. And the group leader one day came up to us and said that, well, there is a refugee camp here. Would you like to go see? So a lot of our group were young youth and young families, and we all said, yes, we'd like to go see. So one bus headed to the camp. When we reached the camp, it was during summer, 40 plus degrees, very, very hot. And we saw lots of tents. We saw a huge generator which wasn't working, so no air conditioning, nothing, no shoes on the kids, and the kids were laughing. We got down there and my husband goes, I'm Tabibul Asnan, I am a dentist. So everybody opened their mouth and we could see a lot of work needed. So we walk around, and before we even got onto our bus going back to our hotel, our group leader says, well, the one thing I'm going to ask you to do is just remove your shoes and put your feet on the sand. And boy, it was hot. I could not believe it. And at that point, I just felt something, I felt torn. I felt that these kids needed so much, and yet back home we are so blessed with a lot and we don't appreciate the ni'mah we have. So we come back to the hotel and I go to my husband and he goes, Fatima, we have to be back here in 7 months. Next year we are coming back.
My name is Hasnain Roshanli Devji. I'm a pediatric dentist who is from the Vancouver area. I've been practicing now for 26 years, and I have my own clinic just outside of Vancouver. Our main aim is to provide dental care, medical and optical care to these orphans to the standard that we would have in North America. So we would like to be able to treat these children like we would treat them here. And over time, we would like to improve their dental, medical, and optical IQ with education, prevention, and things like that. Inshallah, in the future, we might also be able to work with the dental professionals in those countries to see if we can improve their standard of care as well and get them up to a higher level.
My name is Muhammad Abbas Hussain. I'm a dentist in Canada. My role in the Iraq camp is I'm one of the many volunteers. It's a group project. I've been there many times and different missions where we work and we help out not only the orphans but also some of the not so well-to-do, sort of in the poor.
Each year we've taken a larger and larger group. The first year it was one dentist, myself, my wife as my assistant, and my 2 children who were doing the sterilizing and things like that. At that time we treated 100 grade 1 children over a 10-day period. The year after that we had 3 dentists. This year, for example, we had 14 dentists, 2 physicians, and an optical team of 3, and a total group of 55 to 60, depending on how you work it out. We had some local volunteers as well. So the group keeps getting larger and larger. We've expanded our scope from just doing children dental needs, comprehensive dental needs, fillings, stainless steel crowns, nerve treatments, things like that, to now also doing comprehensive optical. This year, for example, we distributed 150 free pairs of glasses to the children that needed them. And from medical perspective, there was quite a few patients who were referred and treated based on the diagnosis done by the medical team.
There is no doubt that a great amount of time and dedication is spent behind the scenes in the planning and organising of these trips, which begins many months in advance.
Planning for the next trip actually started the day we left Iraq to come back. That was the initial planning that had already actually started before that, because we're already thinking of next year as to where we'll stay, what accommodation is available in the area, how many children are we aiming to treat, what kind of group are we going to have. The actual volunteers, we usually try and get the volunteers about 6 to 8 months ahead of time, getting them organized. The packing and the ordering takes 3 to 6 months. When you're packing for 14 dentists, for example, and I'm just talking about the dental side because that's what I'm most familiar with, it does take 3 to 6 months for us to actually organize all the stuff, get it shipped to various areas so that people can bring it into the country. In Iraq, unfortunately, we cannot get a lot of things locally, so everything that we use has to be brought with us.
There was a young girl. She was about 6, 7 years old, maybe 8. Anyway, around 7 years old. What happened was that she was ostracized with all in her class from our classmates. What had happened was that she was born with no enamel, no front cover of her teeth. So her teeth all looked yellow and broken and dirty. She basically had multiple abscesses. It took us about 3-4 hours to drain the abscesses. That's how much infection was in her bone. That's how much pus that was coming out of it. After draining it, and then what happens was we ended up started fixing it. It took us about 3 to 4 days of full-time, 8 hours working on this girl to get her every tooth fixed up, because every tooth basically needed a root canal, filling, capping, and all the teeth had to be worked on. At the end of it, I remember the look on the father's eyes, and he started bawling his eyes out. And he started crying, and I said, you know what, listen, we've been blessed, don't worry about it. I'm glad we can help. It was a team effort. It was the whole group sort of thing. We worked together on this. And he says, no, you know what, you don't understand. I said, what do you mean? And it was through a translator. He said, this girl, because of all the abscesses, she had bad breath. And because of the bad breath, and because her teeth were looking yellow because they had no enamel on it, the teachers were sort of saying, see, your teeth are dirty because you don't brush them, and that's why your breath smells. Her friends didn't want to play with her. Her cousins did not want to talk to her. She was ostracized. And I remember the dad was saying that he took them to a dentist, and the dentist sort of, she was a young kid, and she was in pain with and he went to work on her, and the local anesthetic did not work because of all the pus that was there. And the dentist slapped her and says, this is why you deserve this, because you're not brushing your teeth properly. Even the dentist misdiagnosed that. And the father said, you don't know. Everybody sort of, she had done nothing wrong, and everybody in her world was telling her that you're no good.
Because of what's happened in Iraq over the last 20 years or so, the needs are very, very significant in Iraq. Plus, Iraq is close to our hearts because of the holy sites that are there in Karbala and Najaf. So there's another attraction to being there. We found that the Iraqi people are very hospitable, they're very welcoming, and there is a definite appreciation for the work that we do there. And over time, a lot of those people who we work with in Iraq have become part of the family as well.
Najaf is a very special place for me. I go to Imam Ali and I said, Imam Ali, you are the one who started this, and we need to continue this. And again, the other thing is seeing the orphans, seeing what the war has done to them. So that was another pull. Because with the other organizations, I don't think any other organization would go to places like this, a war-torn country. With social media saying that Iraq is always in war, there are no safe cities and all that. And we know that there are just certain parts of Iraq which is not safe, and then there are certain which are safe.
With the deterioration of healthcare over the last few years, Iraq faces new challenges in the modern day. As the Arba'een pilgrimage is attracting a larger and larger mass of pilgrims each year, Iraq needs to ensure that the pilgrims' medical needs are taken care of. The centres that serve during the Arba'een period are immeasurable in number. From providing food and drink to medical care to the visitors of Imam Hussein, there is a large force of people who work tirelessly to serve the pilgrims. Amongst the many medical activities established in the city of Karbala is a hospital located very close to the shrine of Imam Hussein. Safir al-Hussein Hospital, in collaboration with Imamiyya Medics International, have set up several medical centres surrounding the shrines in Karbala to ensure that the health needs of the pilgrims are catered for in the most efficient way possible. The hospital itself provides medical care to the pilgrims 24/7 during the days of Arba'een. Dr. Amir Jalal Khan, founder and director of Safir al-Hussein Hospital, is a general practitioner who used to work in Milton Keynes, UK, before moving to Karbala 4 years ago to set up this hospital.
مستشفى سفير الإمام الحسين عليه السلام الجراحي مستشفى متخصص في مجال الجراحة العامة وجراحة المجاري البولية. تم افتتاح المستشفى قبل حوالي 4 سنوات ونصف. الآن عمر المستشفى هو هذا الفعلي، ولم تغلق باب المستشفى لحد هاي اللحظة ولا لدقيقة واحدة منذ افتتاحها. المستشفى هو من المستشفيات الفريدة بالعراق بنظام الإدارة، باعتبار مستشفى تم إنشائها وتجهيزها من الأمانة العامة للعتبة الحسينية المقدسة، ولا زالت هي الجهة المتابعة لموضوع المستشفى والراعية له بشكل كبير. وإداريا وفنيا المستشفى مرتبط بدائرة صحة كربلاء المقدسة اللي هي تمثل سلطة وزارة الصحة العراقية في المحافظة.
The hospital provides clinics for consultations with experienced doctors, but deals primarily with emergencies. A nursing clinic has been set up at the entrance of the hospital, which acts as a triage, so the hospital can concentrate its resources on dealing with emergencies, complicated cases, and surgical operations. In total, the hospital administers 9 medical clinics around the city of Karbala, including 3 centres inside the shrine of Imam Hussein.
العام الماضي حسبت حساب انه راح يجيني حدود 200,000 مراجع. أدوية وتجهيزات طبية وفرتها بما يكفي لهذا العدد، وحصلت بعض المخازن من العتبة الحسينية المقدسة باعتبار هاي المنطقة كل صعبة الحصول على مساحات فارغة حتى واحد يخلي بها مؤسسات معينة. وصل عدد المراجعين العام كان انذارنا لمدة 12 يوم لأنه كانت زيارة جدا مزدحمة أيضا. عدد المراجعين اللي شفناه وصل إلى 400,000 مراجع، 406 يمكن أو شيء من هالقبيل، أكثر من 400,000 مراجع بشوية. طيب وين أنا حاسب حسابي على 200,000 وشفت 400,000؟ شلون شفتهم؟ شنو التسهيلات اللي رب العالمين سهلها إلي بحيث أنا كنت قادر على أنه أقدم الخدمات الطبية لهذا العدد الكبير؟ حقيقة يعني لا يعلم بها إلا الله وأئمة أهل البيت عليهم السلام، لأنه لا يصمد أمامها لا تخطيط ولا علم ولا ضوابط عالمية تقف كل هاي الأمور أمام هذا التحدي. ويمكن أنتم إذا صورتوا في لحظات معينة أو في ساعات معينة المنطقة اللي أمام باب المستشفى تكون مغلقة تماما عن الزائرين، توصل مرحلة أنه الناس ما تقدر بعد تتحرك. هاي المسألة لما صارت عندنا بالزيارات انعكست على زيادة بأعداد المراجعين. فكرنا ممكن انه احنا نتجاوز هاي القضية اذا قدرنا نفتح مفارز اكثر في المحافظة، خصوصا في المنطقة المحيطة. إن فتحنا هالسنة 9 مفارز، التحقت في مستشفانا 9 مفارز ومواقع لتقديم الخدمات الطبية. توقعنا أنه راح نستطيع أنه نتعامل مع العدد الكبير من المراجعين اللي راح يجونا إلى المستشفى. اللي صار أنه هاي السنة خلصت الزيارة ب 14 يوم إنذار، يعني زدنا عن العام الماضي تقريبا يوميا حتى نقدر يعني نغطي الازدحامات الكبيرة اللي عندنا في المنطقة. وصل عدد المراجعين هذه السنة إلى 1,300,000 مراجع وأكثر شوية. هذا العدد الكبير من المراجعين اللي وصلت الأعداد اللي زارت المستشفى من المرضى، هم راح تسألني كنت متوقع أني هيك عدد؟ أقول لك لا، ما متوقع. بس اللي ساعد على تقديم هذا العدد الكبير اللي احنا أخذناه من المتطوعين، العدد الكبير أو النسبة الهائلة من الدعم اللي تقدم لنا من العتبة الحسينية المقدسة ومن دائرة صحة كربلاء المقدسة، ومن ناس هم اجوا يعني دخلوا يا اما يستفادون من الخدمة الطبية وشافوا الوضع اللي احنا بيه وحقيقة تعاطفوا معنا وصاروا هم متطوعين، أو من أشخاص هم جايين يردون يشتغلون.
To cater for the large number of patients that the hospital receives during Ahlulbayt, it requires sufficient staff and volunteers to ensure the services run smoothly. Last year, the hospital had a total of 1,000 workers, approximately 750 of which were volunteers. They are scheduled to work 12-hour shifts every other day, but some volunteers go above and beyond, working 12 to 14-hour shifts daily, and even work late hours at night. The medical care that this hospital offers is provided completely free of charge. From medicines to consultations and treatment, the patients are under no financial liability to pay for it. The same medical service provided by Safir al-Hussein Hospital would not cost less than £5,000 outside of Iraq.
من أني أشوف إنسان بسيط وعمله مو بذاك العمل اللي قد أنت تتصوره أساسي في أي مؤسسة، يضحي بوقته ويداوم أكثر من 14 ساعة يوميا من أجل فكرة واحدة فقط في باله، هي خدمة الإمام الحسين أو زائرين الإمام الحسين. وأقارنه ويا نفسي، أشعر نفسي أنا عاجز. نعم، وجودي في لندن وكنت أنا أعمل في ميلتون كينز كجي بي إلى كان نوع من الاستقرار وحياتي ماشية وأطفالي وعائلتي والحمد لله كانت الأمور تمام. بس من أخلي هذا في كفة وأخلي أن أكون في بلدي وفي مدينتي اللي أنا أحبها وفي خدمة إمام الحسين عليه السلام اللي أنا أعشقه مو بس أحبه، هذا ينطيني دافع كبير جدا أنه أخلي كل هاي بكفة وموضوع الاستمرار والبقاء في بريطانيا في كفة أخرى.
Imamiyya Medics International has been coordinating medical missions to Iraq during the days of Ahlulbayt since 2010. In collaboration with Safir al-Hussein Hospital, it provides medical services to the pilgrims through 2 medical camps, one at the shrine of Imam Hussein and the other at the shrine of Al-Abbas. During Reborn last year, they set up a total of 8 medical centres, which included clinics specialising in eye and dental care.
Assalamu alaikum. I'm Dr. Muhammad Muzaffari. I am the dentist representing IMA UK, Imam Medics International. I'm one of their board of directors for their UK chapter, and I'm one of the dentists in the annual Ahlulbayt medical mission to Iraq. IMI has been coming in for 7 years now. Alhamdulillah, every year the group's been growing in numbers, in specialities and in interest. So it's lovely, as a first timer myself, it's great to meet and see experienced physicians and dentists and doctors and nurses that have had a lot of experience in the Middle East.
I'm the lead in the dental departments for Imamiyya Medics International, working here in Karbala for the last 7 years. I'm also a hands-on dentist. However, for me, I try to manage the 2 camps that we have, and this time, alhamdulillah, we had 8 dentists, so this was the strongest dental team we have had. And the dentists came from Kenya, Tanzania, Pakistan, Canada, and United Kingdom. The first year we were only 8 people, the Imamiya medics came only with 8 people, and basically I don't think we did much justice for being here. However, over the years, this time we are 100 plus. I would say we are 120 plus, and we have had the expertise has developed, and we have added on certain health professionals. In the last 2 years, optometry has been the benchmark or the flagship of Imamiya medics.
The clinic is required to deal with a diverse range of medical cases, and so doctors and health professionals of various fields accompany the camp. From rheumatologists, cardiologists, neurologists, as well as general surgeons and paediatricians, all of whom are volunteers. In total, the camp runs for 12 days over the Arba'een period, and the volunteers work in 8-hour shifts around the clock.
My name is Mujahid Hussein Walji. I'm from Dar es Salaam, Tanzania, and I have come as a pharmacist for this IMI Arba'een camp. Our task was to ensure that we have the drugs that will be required during the camp, and also to assist the doctors in the prescribing, and because you see we have come here with limited drugs. Okay, this is a very temporary to the clinic, so we had to choose those drugs that we can carry limited and those that will be needed most during the camp. So that was like sometimes the doctors would come and say we need a certain drug, but that's not there. Instead we have a substitute. So that's where we pharmacists come in ensuring that the medications that are available for the doctors, the common indication that we see here.
Assalamu alaikum. My name is Mazahir. I've come from New Jersey, USA. Inshallah, studying to be a pharmacist. So over here I was able to help out with the pharmacy end a little bit, but also help out with just the everyday taking care of processes. So I did everything from sweep the floor to collect boxes to clean up, and I was kind of everywhere. I did everything I could to just get the time off and pay my respects to Karbala in itself. And I think, alhamdulillah, like I got the call, and everything kind of fell into place because that was my intention to begin with. And then I linked up with IMI, and I was able to come here and help serve the Reborn.
As Arba'een approaches, the number of patients seen rapidly increase. In the days leading up to Arba'een, approximately 600 to 700 patients are treated per hour. This number multiplies, with around 2,000 to 3,000 patients on the day of Arba'een itself.
My name is Mary Shirazi. I am originally from Iran, but I live in the US. I'm from Oregon. I'm at an administrative role in the clinic. This was my first time actually this year. Our task was to introduce the patients, to get them to know what their problems are, and I had a major role in translating. There are 80% of our clients are Iranians, Farsi speaking, so there's a real need for translators.
Overall, the camp varies. As a whole camp, we vary somewhere between 400 and 600 a day. Predominantly, I'd say between 60 and 70% of the patients have acute problems such as blisters, boils, cramps, issues because a lot of them have walked from Najaf, dehydration, diarrhea, vomiting, flu or influenza. You also get a lot of people who've lost or failed to take their medication, so chronic problems such as diabetes, asthma, problems with blood pressure, which need to be managed in the acute stage.
My name is Dr. Yasser Al-Madani. This year I'm the co-leader of this camp of Al-Abbas al-Salam, which is run by the Imamiya Medics International. And my other co-leader is Sister Shaina Ali from Tanzania. The walk of Arba'een, observed Arba'een, brings its own challenges and difficulties. So, walking, and many people choose to walk barefoot for long distances, hundreds of kilometers or tens of kilometers. That's not what people are normally used to. Especially the conditions of the roads, etc., etc. So, that people develop blisters, they develop wounds, people develop pains and aches. People have long-term medical health problems such as diabetes, hypertension. A lot of people are not compliant with their medications, so they don't bring up enough supply. They don't think ahead that I'm going to run out of supply. They come here with high blood sugars, high blood pressures uncontrolled, and they've not been taking medications for X number of days. People come with dehydration, it's hot, especially during the day. They've not been drinking, not been looking after their health. And then there's obviously the infections, you know, the colds and diarrheas and all sorts of infections that, you know, are so easily passed on because it's so crowded here. So there's a lot of need. You know, whenever you have such a large congregation of people in one place, you know, there are health problems.
We had patients with surgical complications. For example, we had a patient with diverticulitis. We tried to stabilize, and it was a day before Ahlulbayt, so it was very difficult to get the ambulance here, and the patient was getting worse with time. But Alhamdulillah, the patient reached Al Safir Hospital and was dealt with appropriately.
This is a training center whereby we try to implement the Western system or a good system in place wherever we've learned it from into this camp, so that making the queues coming in a systematic way, making a triage system initially and then going to the doctor if they need be. Otherwise the first acuity patients which are seen with the low acuity are sent home from the outside by the triage doctor, and then if they have higher problems, then they come inside the camp and get dealt with in a room by doctors who are specialized.
Some of the medication used to treat patients are bought locally and some imported from Iran. A portion is also provided and funded by the Shrine of Imam Hussein from the budget allocated to them by the Ministry of Health in Iraq. A lack of lab facilities means that treatment is mainly based on taking clinical histories of the patients and a thorough physical examination. The camp tries to facilitate and treat as many cases as possible within the camp itself, as referring patients to Safir al-Hussein Hospital is not easy.
I think one of the biggest challenges is the mindset of the Middle Eastern people. They have a different way of thinking than we do in the West. So often what would be seen to be urgent for us, or things that have a high priority such as healthcare, such as emergency drugs, things like space, hygiene, particularly hygiene, aren't valued as much in this country because, unfortunately, with there being less money and there being a war-torn country, the priority shifts to other more important things. So as a result, it's difficult when you want to work in an environment and educate people about the value of sterility, particularly sterility and hygiene, the value of washing one's hands before you eat, the value of having clean instruments that you work, having the value of maintaining a clean field. So if someone has been on something, to clean that area before another patient comes, to avoid cross-infection and to avoid the exacerbation of diseases, has been a real difficult challenge for us. And so it's been a learning curve about how to support people that don't necessarily have the same perspective on hygiene as you do.
When we want to refer a patient, for example, it's a big challenge because the ambulances just can't pass through. That is one biggest challenge we have. Secondly, we have challenges such as if we get patients with suspected heart attacks, we don't have ECG machine, we don't have ultrasound, portable ones that could actually make life easier for us and for the patients. Though every year we try to improve the service, every year we try to improve the number of health care providers. This year, for example, we were more than 100 people coming from all around the world to give service, but it's never enough.
Patience is I must admit, I can't for a minute admit that I've mastered the art of patience. Despite 5 years coming to this camp, I still find it difficult and challenging. You know, the language barrier, the health expectations, you know, there's lots of different things. The overcrowdedness, you know, not being able to move. Our hotel is literally 2 minutes away, and it takes us half an hour in the days of Ahlulbayt to get here. On top of that, there's growing need. You know, the ziyara is growing every year, and the number of camps, even with the current existing number of camps, not just Imamiyya Medics International, but you know, the Ataba camps, the delegates from other countries that have come from Iran, from Bahrain, the Iraqi camps, the Red Cross, is not enough. Every corner needs you know, there's so many people, you know, everywhere you go.
I think we are very, very fortunate where we live, and we need to give back. And this is one of those ways of giving back. Iraq has been very close to my heart. I've been coming for the last 7-8 years with a different organization to do dental work here. This was my first time with the IMI dental camp. So obviously Imam Hussein is what brings us here.
The preparation for the preparation for the Arbaeen camp from next year will start straight after 1 month. So I'm a busy urological surgeon, but and I work in 3 hospitals. But even with that, I am ready to sacrifice whatever I can in those circumstances to start the preparation the whole year round for this camp. My wife also sometimes asks me that you are really getting stressed and you have a lot of work to do and you still are doing that. I tell her that the preparation and the work for serving the Zawar of Hamsen and working for IMI is my time out. And I get that satisfaction, I get that enjoyment, which I can't get for anywhere else.
I think I've always had a passion for community work, outreach work, and helping the wider community. And after a number of years of doing work in the UK, I felt I'd like to pass my skills on to those more greater in need than in the UK. My first thought was Iraq as a country that has supported the Muslim community for as long as it has with its pilgrims. I felt that it would be a good way for me to give back. Alhamdulillah, that I had the opportunity and the tawfiq from Allah and the invitation from the Imam to come and to join the camp, that I could come and give the small percentage of my skill and small percentage of my time back to help the wider community, because they don't have what we have and they don't have the opportunities that we have. And so by helping in the small, you can overall help the great.
During Arbaeen, people all around the world flock here. They don't even know where they're going to sleep. They don't know what they're going to eat. But there is so much unity, so much selflessness, that you feel like, why can't I give my service in a way or two? People cook for people, people have food for people, massage their legs. Alhamdulillah, we have the knowledge to serve people, save lives, then why not?
The way we see that the locals are serving, even we feel motivated that why can't even we do. I mean, we know that even the poor in local Iraqis do so much for the Zawars. So whatever we can do in our capacity. So we as a professional, like for myself, I'm a pharmacist, I would come and help as a pharmacist for the Zawars of the Imam Hussein of the Zawars.
I think it's a great blessing and a privilege to be serving the Zawar of Imam Hussein. And when I heard about this program, the IMI medical mission, I was really interested and I got to know about it and went through the application process and was able to get accepted. And I think it's an amazing responsibility and a privilege to be serving the Zawar of Imam Hussein and to be in this spiritual atmosphere, especially at this time of Arbaeen when people from all over the world come.
The people who have come before me, they told me it's a very rewarding and spiritual experience, and now that I've gone through it, I totally agree with them. It was very, very spiritual, and I'm really glad I took part in this thing.
If you say that this is a charity work somewhere, people will think twice, and they will say, okay, maybe next year we will do something about it. But the magnetic attraction of Imam Hussein makes them come here.
Their experience is to test our patience, akhlaq, and of course love for humanity. I think this is the most essential thing that you will find. Imam Hussein's message was about love and sacrifice, and I think by serving the Zawar of Imam Hussein and by keeping our humility and humanity at the same time, I think that's the most lesson that we have, to be flexible and to be as most tolerant and understanding as possible.
I've actually learned how welcoming the Iraqi people are. I was dumbfounded by their hospitality on the walk, the people serving everything from tea to food, etc. And the way that we were treated here has been just amazing. Kudos to the Iraqi people for hosting this many people in such a small place.
I think Imam Hussein al-Salam has provided us with a motivation to do good. And there's so many ways one could do good. In London, there's the Imam Hussein Blood Donation Campaign. It's a fantastic project. We're showing the people that in the name of Imam Hussein, we're doing this. There are so many other projects across the world where people are doing good and serving mankind in the name of Imam Hussein. Whether it's donating blood or whether it's working here in the camp, seeing a dehydrated patient, or seeing a patient who's critically unwell, transferring to hospital, stabilizing him. If potentially we've saved one person, as it says in the Quran, it is as if we've saved the whole of mankind. This is greatly valued in Islam. So, and the motivation that is provided to us to come and volunteer, for this camp and to serve these people is purely from our Rasul and the sacrifice that he's made.
There's multiple motivations. I think in the heart, Allah has been the most kind to me in my life, and so you have to serve Allah in one way or the other. On the path towards Islam, on the path towards being mu'min, on the path towards taqwa, you have to make a point in your life where you say it's no longer about the me, it's about the wider community, it's about helping others. Particularly one ayah comes straight to my mind from Surah Muhammad, and it's Bismillah ar-Rahman ar-Rahim, Ya ayyuha alladhina amanu in tansurullaha yansurkum wa yuthabbit aqdamakum. Those who believe, if you help Allah, He will help you and plant firmly your foot. And so the ayah speaks volumes to me that if you want to be solid in this world, you want to have a solid foundation, you want to be successful, you want to be rich, you have to support Allah. And therefore by that Allah is meaning support khalqullah, support the creation of Allah that are in need. And that is the East, and that is including Iraq, India, Pakistan, places where they don't have the opportunities that we have when we were growing up, or even still have now.
There's a draw, something is drawing us here. And part of it I think is the holy sites that are here. And I also think it's because of the suffering that the Iraqi people have gone through, the number of wars that they've gone through, the oppression they've gone through under various governments, etc. So I think that is what the draw is to come here. It's a very special place for us.
Imam Hussein's message of freedom and liberation is very aspiring to all generations. It's a non-ending message for all generations, and I think as a woman, for me, it means that women can accomplish in whatever they want, and there's no restrictions for them. And of course, the essence of love and humanity is all, is a global, it's a transnational concept. It's not just for Muslims, it's worldbound. And I think we need, and I think the Arba'in message transcends this symbolic factor that we see millions of people coming here and getting together without any kind of conflict and any violence, and this is what true Islam means.